thank you to the audience and all the judges for coming to listen to us. So I'm going to be talking about how to increase COVID-19 vaccination rates, specifically here in Riverside County. So I don't need to tell anyone here, as we are in a Zoom room, that COVID-19 has been a really serious pandemic that has had a huge detriment to the United States. We were rapidly approaching 1 million deaths, which was really depressing when I had to up this number from the last time that I gave this talk. And another way to think about this number is that 200,000 children have lost a parent in the United States to this pandemic. But what we do have to prevent this pandemic is really effective vaccines, which have been awesome to see that have been developed in such a short period of time. In fact, the current CDC research, even against the new variants, shows that there's a 94% reduction in intubation and death for people that have been vaccinated and boosted against COVID-19 versus those that are unvaccinated. So far we have a pretty strong defense. The tricky thing is that in Riverside County especially, we are not sufficiently protected against COVID-19. When you look at vaccination rates statewide, we're about 75%, which is pretty decent, getting there. And in Orange County and San Diego County, our neighboring counties of similar size, we've got 75, and good job, San Diego County, 84.4% vaccinated. But Riverside County, for a wide variety of reasons, is really lagging behind at 62%. And what we do when we reach out to the community is what we find that there are ways that we can improve this vaccination rate, although it's going to be hard work. The first way that I propose is through more community outreach. This is going to be a slow and tricky process and will be frustrating sometimes for us when we think, oh, vaccines are obviously the way to go. It'll be easy to convince people, but it may be harder for those that are systemically disenfranchised in our community. So what I propose is more funding for labs that prioritize outreach. So this will help alleviate scientists' pressure to constantly produce new research by giving them a little bit of support if they're willing to take some of their really precious time and reach out to the community, perhaps through lab open houses, and also continuing on and expanding community forums, allowing people to just air their concerns about the vaccine. It's normal to be unsure about research that is fresh, hot off the presses and has just come out. That's what scientists do. So we can kind of feed into that process from our community and allow them to feel heard. So the CDC has some resources on this as well, and how to talk to friends and family who present ideas about the vaccine, what to say to someone if they say, I heard that the vaccine is dangerous, I hear that there's a lot of side effects. By responding to these people with open, caring, thoughtful responses and being willing to listen to their challenges, we can hopefully get people to understand that the vaccine is absolutely going to be our best way forward and out of this pandemic. And the second piece of this is going to be a little bit faster, a little bit tougher method of getting out of the pandemic. I think we're starting to get to a stage where exhaustion is going to be our biggest challenge in fighting the pandemic, right? People are no longer going to be comfortable with staying home, working from home, and shutdowns and even mask mandates are starting to no longer become very socially or politically viable. So if we take those off the table, our really only ways of fighting new variants in a highly strained healthcare system is going to be vaccine mandates and frequent testing. And how do we make those a natural part of our everyday is by really being strategic about who we mandate with a vaccine. Of course, there's historical precedents for vaccine mandates. I always include George Washington on this for mandating smallpox inoculation, which likely helped the United States win the war against Great Britain in the American Revolution. But unfortunately, that's just not as easy to do politically viably now. Unfortunately, President Biden's vaccine mandate for all businesses, for all of their employees, was taken down by the Supreme Court, and OSHA estimates that 6,500 lives would have been saved if this had been held in place. There is a current proposal, Assembly Bill number 1993, that would have this similar mandate for statewide for California, but I propose that we'll instead have a little bit tighter in terms of who we're mandating, and that would be people in high-risk populations, high density populations, and optional participation. So schools, universities, concert bars and restaurants, senior living facilities and healthcare settings, but not for private employers like AB 1993 proposes because of legal viability. Okay, thank you, that's it.